It's very common. 1 out of every 4 women have female pattern hair loss. It's a very common condition, and that number actually may be low. I was just in a meeting last week in Orlando, and this discussion was perhaps up to 40% of women experience hair loss. And as far as transitioning, it is a very difficult thing to accomplish because most people have no idea that it can help in the way we can. Breast augmentation is available. All the other procedures that are done to feminize a person are pretty well known. Not commonly done everywhere, obviously, but very well known. And then I'll never forget, it was in 1989 when I opened my practice in Providence. A woman came in who was transitioning. This was back in the 80s now, so she came with ruby red cheeks with rouge, and she had a hairpiece on that just looked terrible. And when the hairpiece was removed, it was typical male pattern baldness, receded hairline and a bald spot. And she says she could do anything with anything else part of her body, but she didn't want to live with a hairpiece, as you described earlier. And you know, no matter how much one changes, if you have a male pattern hairline, it looks like a male pattern hairline. And with transplantation, many people don't know what I do or what transplantation is, but what hair transplant is this hair genetically grows lifelong. So if I surgically move skin and hair follicles from this area and transplant it anywhere in the head or anywhere in the body for that matter, they will maintain the genetic integrity to grow forever, and they will do that. And the hairs will grow, and you can cut and curl and comb and color. It's one's own growing hair. And that's the beauty of transplantation.
Yeah. It's a very cool procedure.
Yeah.
You know, I mean, I obviously, I have been through, you know, in my transition, a lot of different kinds of procedures, some of which I would equate to being hit by a bus. A lot of them were, you know, were very serious procedures.
Sure.
And this was a procedure that I went through, and like I say, I got to sit there and watch movies, some very cool movies, in fact. You have a good selection of movies.
Thank you.
By the way, your staff is wonderful.
I agree.
I love coming to your office. Your staff is so nice, and you know they're always just so nice to me, and it's always a pleasure. But so tell them for me that I think they're wonderful. But this was a thing that the procedure itself. I mean, what I had to go through for this procedure, I think the worst part of it was the Novocaine or the local anesthetic. Yeah, it's like getting pricked with a needle a little bit. Other than that, I just sat there and watched movies. Obviously, what you guys do, I mean, you have to surgically remove some scalp, and you have technicians that then microscopically.
Right. What I typically do, I lift. This is called the donor area, the area from which the hair is donated, and I lift that area up with hair clips in a row, shave about a half-inch band of hair, numb it with local anesthetic, and really the first anesthetic, definitely a pinch and a burn. It's the craziest thing that local anesthesia pinches and burns, but that's what happens. So you have this original initial pinch and burn, and then slowly the area is numbed up. In an area that's numb, it numbs up the whole back of the area. And after it's completely numb, I surgically, as I described, remove that strip of skin that have all these shaved follicles in it, and that gets put aside in salt water. And then I suture that area together. It's stitched up. And then remove the clips, and the hair completely covers over the donor area, so there's no noticeability back there. And then, my staff will then dissect those strips into tiny pieces called grafts, and grafts today have 1, 2, and 3 hairs, essentially. The old days of the plugs were like a pencil eraser, 20, 30 hairs. Right. But they're not microscopic, they're tiny, tiny pieces. And they're placed aside in salt water. And then at the beginning of the procedure with the patient, we mark the area to be transplanted. And after it's marked, that area is numbed up. And after it's numb, I then, with a needle really for single hair grafts, I make tiny little incisions in the skin, very importantly following the direction of hair growth, the angulation from the surface of the scalp, the configuration of where these slits have to be made, and then my assistants plant all of the grafts that we created from the back. They're all in place, and they're shaven, obviously, to skin level. And then we shampoo the patient's hair, and he or she goes home. You can drive yourself to and from the office. Then the hard part comes to the patient is waiting.
Right.
Because what happens is about 7 to 10 days later, we remove the stitches, and the hairs in the grafts, which had been shaven to skin level, will begin to grow. They grow to about a 1/4 inch in height, and then they fall out. And I get phone calls. My hair is falling out. What's going on? That's a physiologic response. The little hairs in the grafts grow out of the grafts, making room then for the same follicle to create a new hair that will be the permanently growing hair thereafter. You have to wait about 3 months for that to occur, and it's a long, long period of time to wait.
Yeah.
You paid your money, you went through the procedure, and now you're sitting there. And sitting there and you're looking every day, is my hair growing? It's not growing with that, Dr. Leonard, I don't know. But you know, what I do is I follow up with a patient at the 6-month mark, because really by 6 months, that's when we really can see a change as far as darkening of the skin. The hairs have grown to a length that's considerable so that there's a visual change.
Right.
But I tell patients 12 to 15 months after the procedure is when you have a final result, because by then everything will have grown through the skin and people will be having haircuts and coloring, whatever. It's your own growing hair. That's what people don't realize, is their own growing hair. It's really an amazing procedure.
Yeah, and I know from doing the research that I had done on hair removal, you start learning interesting things like, I think it's 1/3 of your hair grows at a time. So when your hair goes through a growth cycle, it's going to take 3 growth cycles before it makes any progress again.
Exactly.
So yeah, it takes a lot of time.
Yeah.
And the most important part of that, or with hair restoration, is that the consultation, you have to know what you're getting yourself in for.
Yeah.
Because if a person's, okay, we'll come and we'll do your transplant, I'll do hair removal, and people expect something because they don't know,
Right.
you're always disappointed. So the consultation is really, and I speak around the world about the hair loss consultation.
Yeah.
And it's very important because you have to set up realistic expectations.
Sure.
You know, you have your nose straightened, it looks straight after a week, huh?
Right.
But with transplants, you have to wait a long month.
There's enough basic healing after plastic surgery in a short period of time that you can see what it's going to look like in 6 to 8 months.
Yeah.
So, but with the transplants,
that's hard. The waiting is hard, but obviously it's worth it. You know?
And the other thing is, I always tell patients that male and female pattern hair loss are progressive conditions. And the transplant is wonderful. The hairs will grow every time. But the transplant doesn't stop progression of existing hair. So hair loss will continue. It's a progressive condition. There's no question about it. So we have different options for people to stabilize that progression. One is Rogain. Rogain's been around since the 1980s. It works very effectively all over the head, front, middle, and back, to stabilize progression in 70% of patients. And it regrows hair 50% of the time. So 70 and 50. It has to be applied to a person's head twice a day, every day, on a long-term basis. So once you start Rogain, it's your friend for life. You have to use it in the long term, but it works well if it's used. The second option for men, or for women who have transitioned, are Propecia. Propecia is a pill. It works very effectively to stabilize further progression of hair loss, mostly in the back of the head. In 83% of patients, and regrows 66% of the time. 1 pill a day, likewise on a long-term basis. And the third option I think you did after surgery was the laser therapy, low-level laser therapy.
Right, that's the
Luce.
Luce, yeah.
Luce.
That's interesting. I did that, and that was kind of interesting. You have a little light thing that you put over your head, and it just blasts you with
laser. It's low level. It's a cold laser, unlike the hair removal, which is a hot laser, very hot laser. The Luce, or the laser therapy, is a technology we've had in the practice about 7 years. And what this does, it stimulates capillary blood flow to the dermis, and the dermis is where the follicles reside. So what it does, it increases the blood flow, allowing for, after surgery, faster healing, early regrowth, 1.5 months versus 3, to start to feel the little hairs grow. And then, for a long term, similar to Rogain and Propecia, will stabilize progression of hair loss in about 90% of patients, and regrowth about 50% of the time. The difference, though, with the laser therapy from Rogain and Propecia is that at the end of the 12-month protocol, it's a 1-year-long commitment. At the end of the 12 months, most people are finished with the laser therapy, whereas obviously with the Propecia and Rogain are long term. About 10% of patients who do the year-long protocol with the laser